Hi, my name is Miranda. I'm a nurse practitioner student and I'll be on your healthcare team today.
I'm Miranda. Jack Matata.
Well, Mr. Matata, is it okay if I call you that?
Sure.
That's a wonderful name.
Thank you.
What brings you to the clinic today?
I wanted to establish a new primary care provider to manage my hypothyroidism.
Okay, how old are you?
29.
And when were you diagnosed with hypothyroidism?
3 years ago, 26.
Okay, what's the name of the doctor that diagnosed you?
Davis.
Davis. Is he in this area?
Yes, ma'am.
Okay. I was wondering because if I have any questions, I can try to get in touch with him. So you want to have a new primary care provider and then have some control over your hypothyroidism, is that right?
Yes, ma'am.
Okay. Have you been having any problems with hypothyroidism lately? Have you been having any symptoms such as weight gain, fatigue, intolerance to heat, anything like that?
No, ma'am.
Okay. Do you feel like it's pretty well managed already?
Yes, ma'am.
Okay. Whenever you were diagnosed with it, did they do any specific thyroid-related tests, such as a TSH, a thyroxine level? Did they do an ultrasound? How did they diagnose you?
They did free T3, T4, and TSH levels.
Okay. Were any other diagnostic tests done?
No, I had complete metabolic profile run,
Okay.
and
do you
that's
know,
how they found it.
And do you know the results of any of your studies that were done at that time?
Um, my TSH was high,
Mm-hmm.
and my free T3, T4 was low.
Okay. And were any other diagnostic tests done at that time?
No, ma'am.
Okay. Did you understand the results at the time? Was it explained to your satisfaction?
Yes, ma'am.
Okay. And prior to having those diagnostic tests done, did you notice anything different that prompted the ordering of those labs? Was there any kind of, again, intolerance to heat? Was there a weight gain? Was there a slowing in metabolism that you had noticed that prompted that checkup, or was it just kind of routine?
No, it was much like today. I was trying to establish a new primary care provider, and they just ran some basic tests just to get a baseline on me and found it.
Okay. Well, if you don't mind, I'm going to be taking a couple of notes during my discussion with you. That way, just for the development of your medical record, I can get things accurate, okay?
Yes, ma'am.
Is that all right with you?
Yes, ma'am.
Okay, let me just take a couple notes here. Other than your thyroid, I would like to go over your medical history, and that way I can get an overall look of your health condition and kind of some things that you've had going on in the past. How would you explain your overall health right now and your just physical condition, your strength?
Generally pretty good.
Pretty good. Okay. Do you feel like overall you're either healthy, not healthy, strong, weak? How would you describe that?
Typically pretty healthy, I think.
Okay. Do you have any allergies to any medications?
Penicillin.
Okay. Do you take any medications right now?
No, ma'am.
Do you take anything to control or treat your hypothyroidism?
Yes, ma'am.
What do you take?
Levothyroxine.
Okay. And the levothyroxine, what is your dose and how often do you take it?
I take 50 micrograms every day.
And you take that in a pill?
Yes, ma'am.
Okay. To this point, how often have you been getting your thyroid levels checked, your TSH, thyroxine? How often have you been following up with that?
Well, as it's been fairly well controlled, it's been every year that I've gone in for testing just to make sure.
Okay, and have those numbers been looking pretty good that you understand?
Mm-hmm.
Okay, so you haven't had many adjustments to medication?
Only in the first year.
And this is your third year, you said you've had
Mm-hmm.
hypothyroidism. Okay. Going back to the penicillin allergy, you said that you are allergic to penicillin. And when were you first become diagnosed? Well, I guess not diagnosed, but when did you first become allergic to penicillin?
I knew, or my parents knew I was allergic to penicillin when I was a kid.
Did they tell you what kind of reaction you had?
No,
Okay, so you
just said just said that my airways closed off and I couldn't breathe.
oh, that's a pretty severe reaction. So we want to make sure that we note that down in your chart, and if we can keep you away from it, we certainly will. Also, I'd like to talk about any other conditions that you might have been diagnosed with. I'd really like to be very comprehensive and make sure I know about any other diseases or conditions that we need to be aware of. Have you ever had a diagnosis of diabetes,
No, ma'am.
hypertension?
No, ma'am.
Have you ever had a heart attack in the past?
No, ma'am.
So you don't have any known coronary artery disease that you know of?
No, ma'am.
Okay. What about, have you ever had a stroke?
No, ma'am.
Do you have any problems with any respiratory diseases such as asthma, bronchitis? Have you ever had tuberculosis?
No, ma'am.
Okay, that's good. You sound overall pretty good. What about any tropical or parasitic illnesses? It's pretty rare, but sometimes we see that.
I've never been out of the country, so no, ma'am.
Okay. I'd like to discuss a couple of immunizations with you and see if you're current on that, if you can let me know. What about polio,
No, ma'am.
diphtheria,
No, ma'am.
pertussis?
No, ma'am.
Okay. What about tetanus?
I've never had it.
Okay. What do you do for work?
I was a welder for a real long time.
Okay. The reason I ask is because a lot of times I see people who, along with their occupation, they have to have a tetanus shot,
Mm-hmm.
and I just didn't know. But with being a welder, you've never had a tetanus shot that you
Oh,
know
I
of?
apologize. I should have clarified. I've had a tetanus shot. I've just never had tetanus.
Oh, I see. Okay, that's good. What about, do you normally take the influenza and flu vaccine whenever that becomes available?
Yes, ma'am.
Do you do that every year?
Yes, ma'am.
When was your last flu vaccine?
Oh, about 3 months ago.
Okay, we're actually just starting into a new flu season, so I would encourage you to get a new one. Whenever you have a chance, that would be good.
Oh, okay.
Have you ever been vaccinated against hepatitis A or B?
Yes, ma'am.
Okay. What about measles, mumps, or rubella?
Yes, ma'am.
Typically, those are administered together. So you have
When I
those.
was a kid, I think I'm caught up on all my kid shots.
Okay. And what about the varicella vaccine, or have you ever had chickenpox?
I'm not quite sure about that one. I think I have had the chickenpox vaccine when I was a kid. I just don't remember.
Okay. And
I've never had the chickenpox, but I think I've had the vaccine.
okay, that sounds good. And the human papilloma virus, have you ever had that?
I don't know what that is.
Okay, that's fine. Moving on, I would like to discuss some other past medical history with you that is in regard to surgery. Have you ever had any surgeries in the past?
Yes, ma'am. I broke my right arm when I was a kid, and they had to go in and surgically reset my elbow, and they put a couple pins in it.
Okay, but how old were you?
10 or 11.
Okay, and what kind of accident did you have?
I was showing off for some girls on the monkey bars.
My. Well, I hope that it was worth your trouble.
Not really. Didn't pan out.
And you said it was your right arm. Can you show me about where you were injured and had your surgery?
Right.
Oh, I see your scar there. That's a pretty good scar. Did it leave you with any kind of functional limitations where you aren't able to move it in a
No,
certain
ma'am.
way? Does it cause you any pain at any time?
Hmm.
And were you admitted to the hospital for that procedure and the care afterwards?
I think so. I don't really remember it all that well.
Okay, and do you by chance remember what the diagnosis was? I know you said you broke your arm, but do you know if it was like an ulnar fracture, if it was the top bone or the bottom bone?
It was both.
Okay. Did you have any complications as a result of that surgery or the care?
No.
Okay, that's very good. Have you ever had any other serious injuries or disabilities besides that one trauma that you had that required surgery?
No.
Good. Okay. What about, I know you mentioned that you take levothyroxine. Do Do you take any other medications?
No, ma'am.
Have you in the past?
Well, just Tylenol for occasional headaches, but
Okay, about how much Tylenol do you take when you need it?
a couple few of the 500 milligram capsules.
So maybe 2 to 3 at a time you take?
Yeah.
Something like that. And about how, the frequency, do you take it every few hours? How often do you take it?
Just once a day.
And how many days a week do you need it, if you just estimate it?
It's just the occasional headache. It's not anything that's chronic.
Okay. That's good. So you don't get frequent headaches?
No.
Okay. Let's see. Have you ever had any blood transfusions, especially whenever you had your surgery?
No, ma'am.
Okay. Do you know your blood type?
O negative.
All right. Along with reviewing your past medical history, I would like to know if you feel or if you know of any mental illnesses that you've had in the past that I should be aware of, whether it's a mood instability, an anxiety disorder. Have you ever had any problems there?
The mood one, you might want to talk to my wife and kids.
Do you feel like you have any attention span disorders?
No, ma'am.
Okay, good. Moving on, I would like to discuss some of the history of your family, if you feel comfortable sharing that with me.
Okay.
And when I talk about family history, I would like to clarify that I mean blood relatives. So this is your mother, father. If you have any siblings, do you have any siblings?
Mm-hmm.
Okay, how many do you have?
A brother and a sister.
Are they older or younger?
Older.
Okay. So this will just address them as well, along with any grandparents that are of blood relation. If you feel like you know any extensive family history regarding nieces, nephews, aunts, or uncles, you're free to share that as well.
Okay, thank you.
Does anyone in the family have diabetes?
No, ma'am.
Heart disease?
No, ma'am.
Cancer?
No, ma'am.
Okay. Are there any blood disorders that run in the family, such as hemophilia?
No, ma'am.
Sickle cell disease?
No, ma'am.
Okay. What about cystic fibrosis?
No, ma'am.
Let me just jot that down there. Epilepsy?
No, ma'am.
Okay. What about arthritis?
We're all welders, so I reckon we all have a little bit of arthritis.
That comes kind of with the job a little bit.
Yes, ma'am.
All right. What about any hearing loss that runs within the family? No. Do you know of anyone that has any sexually transmitted illnesses or infections?
No, ma'am.
Okay. Are there any concerns about Alzheimer's in the family, Parkinson's?
No.
All right. Let's see, moving on. I would like to discuss not so much your past medical history, but some personal questions that I could ask you just about kind of your social life. Where were you born?
I was born in Texas.
Okay. So you've kind of stayed local to the area?
West Texas, yes, ma'am.
Okay. Were you raised, could you describe the home situation in which you were raised?
How do you mean? Like mom and dad? Or?
Yeah, were your parents married? Were they divorced?
Oh, married.
Okay, was there any abuse that went on in the home?
No, ma'am.
Okay. Do you feel like your parents were supportive or not supportive of you?
Very supportive.
Okay, can you briefly describe your educational background?
I have a high school diploma, and then I have a 2-year technical training degree from a technical institute for welding.
Okay. Are you married?
Yes, ma'am.
Do you have any children?
Yes, ma'am.
How many children do you have?
6.
Wow, that's great. You look so young. You look great. And how long have you been married?
7 years.
Very good. Also, can you tell me some of your, I guess, how you would describe your life satisfaction? Do you feel like, if you could just share that with me a little bit?
I reckon I'd say pretty well fulfilled.
Okay. What are some of your hobbies or interests? Do you have, I know you said you have 6 children and a wife. They might keep you busy.
We like to go to the park. We like to go bike riding and just kind of hanging out outdoors.
Would you say you're pretty physically active?
Yes, ma'am.
Okay. About how often do you exercise?
Nothing intentional. We just, we get in a lot of exercise with the kids and with work.
Okay, very good. Also, I'd like to discuss some of your dietary um, habits. How would you say you normally eat? Do you eat well? Do you eat something that's high in salt, high in fat? Can you describe your diet to me?
Mm. We mostly eat at home.
Mm-hmm.
Home cooked dinners. Um, we don't eat a whole lot of meat. What we do is maybe lunch meat on occasion or chicken breast, fish. We
Okay.
don't eat a lot of red meat.
Okay. Do you drink tea or caffeine, coffee?
Yes, ma'am.
And how many drinks of those do you have a day?
Oh, I'll have a coffee in the morning, and we have a couple times a week we'll have sweet tea.
Okay. Um, do you use alcohol?
I can have a few beers a week, usually with dinner, but not more than one or two at a time.
Okay. Do you use any kind of drugs, whether it's marijuana, amphetamines, cocaine, any illicit drugs?
No, ma'am.
All right. Um, do you smoke?
No, ma'am.
All right. Have you ever?
No, ma'am.
Okay.
Just smoke from welding, but we use respirators.
Okay, good. And you use yours as you need to?
Yes, ma'am.
Um, does anyone in the family smoke? Or are you around secondhand smoke?
My mom, she smokes.
Okay. And was she a smoker throughout your childhood?
Yes, ma'am.
Okay. Have you ever had any kind of, I know you kind of mentioned that you weren't having any breathing problems, but you've never had asthma either?
Mm-mm.
No effects of the smoking that you're aware of?
Not that I'm aware of. No.
Good. Okay. And then I would like to move on to a kind of a more sensitive topic, and if you're comfortable sharing with me, I think it would be good for me to know, just to get an overall idea of your health again.
Okay.
I would like to address the idea behind what some people feel a little uncomfortable with when it comes to male examinations of like a breast exam. Do you ever perform a breast exam on yourself?
Don't reckon I have any reasons to.
Okay. Have you ever had a physician perform a breast exam on you in the past?
No, ma'am.
Okay. We can discuss that here soon. Also, another sensitive topic that I would like to talk to you about, but I do think is pertinent to our conversation today, is your sexual history. You mentioned that you are married, and you have been for some years now.
Mm-hmm.
How many sexual partners have you had in your past?
Just one.
Okay. And have you ever been screened for any sexually transmitted illness?
No, ma'am.
Do you know if your wife has?
No, ma'am.
Would you happen to know how many sexual partners she has had?
One.
All right. Do you have any concerns about your sexual health, whether that is erectile dysfunction, ability to orgasm, sexual satisfaction? Do you have any questions about that?
Nope.
Okay. I would like you to briefly describe some of your home conditions at home with your wife and your children. Do you feel like you have any concerns when it comes to home finances? Are there any stressors in the home?
Every now and again, but we pay all our bills on time, and I think we're pretty solid.
Okay. Can you describe the condition of your home? Is it do you feel like it's a safe place, both physically and emotionally?
Yeah.
Okay. And has there ever been any type of abuse that has occurred in the home, whether you or anyone else?
No, ma'am.
All right. You did tell me that you're a welder. Are there any safety concerns besides the natural dangers that can be accompanied with welding?
No, ma'am.
Okay. So you take all the safety precautions that you need to. You use a welding hood. You use a respirator.
In as much as I know to, yeah.
Okay. And you use flame retardant clothing.
Yes, ma'am.
Alrighty.
Industry standard.
Do you have any other environmental exposures to any kind of dangers such as asbestos that has been known to cause a condition called mesothelioma?
Not knowingly, no, ma'am.
No, so you're not regularly around any kind of construction.
Mm-mm.
All right. Do you have any religious preference, or do you associate yourself with any certain spiritual
We're Catholic.
entity? Okay. Do you have any restrictions or requests that are associated with your religious affiliation?
Well, if I ever go to the hospital, just call a priest.
Okay, that's good to know. Um, let's see. Do you feel like you have adequate access to health care?
Yes, ma'am.
You have your own transportation. You don't have trouble getting to doctor's appointments?
No, ma'am.
Good. All right, so I have a few questions. I think we pretty much covered your past medical history and your social history, so I would like to move on to ask you about certain um, systems of your body.
Okay.
And you're welcome to share any information you'd like to share with me. Excuse me. In general, do you ever experience pain, chills, fatigue, cramps, anything of the sort like that?
No, ma'am.
Okay. Do you ever notice any kind of rash, itching, ulcerations, lesions, anything
No, ma'am.
of the skin? Have you noticed a change in hair growth or a loss of hair in a certain area?
No, ma'am.
All right. Do you ever feel like you're having any kind of dizziness, lightheadedness? Have you ever had any severe head injuries I should be aware of?
No, ma'am. My wife might tell you different, though.
Good. Have you ever had any concussions?
No, ma'am.
All right. Do you feel like you have any trouble with your vision, whether it's adjusting to light, if it's seeing at night whenever you're driving? Do you have trouble focusing or seeing far or near?
No, ma'am.
Good. Have you ever had any kind of glaucoma or cataracts?
No, ma'am.
You're pretty young. I didn't think so. Do you feel like you've had an early onset of hearing loss? Do you hear people well when they're talking to you?
Yes, ma'am.
At a close distance and far? Pretty normal?
Mm-hmm.
All right. Do you ever feel like you've noticed a drainage of the ear or ringing of the ears?
No, ma'am.
Good. Let's see. Your nose, I would like to review. Do you feel like you have an adequate sense of smell?
Mm-hmm.
Do you normally have a runny nose or any discharge from it?
I have seasonal allergies, but...
Okay. Do you take any medication for that to help control it?
Green stuff is Zyrtec?
Yes.
Zyrtec?
Okay. And do you know the dose on that by chance, or do you just take the over-the-counter recommendation?
Just the over-the-counter.
Okay, but how often do you have to take that to control your allergies?
It's a once-a-day sort of deal, but I only do that when I've got the allergy symptoms.
Okay, do you get sinus pain? Do you feel like your sinuses get congested with that?
No, ma'am.
Okay, you've never seen a doctor related to the allergies?
No, just itchy, watery eyes and runny nose.
Okay, so moving on to your throat and your mouth, do you ever feel like you have a chronic sore throat?
No.
Do you get dry mouth, or do you have halitosis, like the real kind of aggravating bad breath that follows you around?
No, ma'am.
Okay, have you ever had bleeding or swelling of the gums or ulcerations in your mouth?
No, ma'am.
Okay, do you feel like your mouth is persistently dry, or do you feel like your mucous membranes stay normally moist?
It's normal, I reckon.
Okay. Have you ever noticed that your lymph nodes anywhere feel enlarged or swollen, or like you've had nodules there?
When I get sick, they get swollen down underneath my jaw, but not anything that's constant.
Okay. What about your chest? Do you ever get chest pain? Do you have trouble breathing?
No, ma'am.
Okay. Have you ever had palpitations before, where you feel like your heart is racing?
No, ma'am.
Excuse me. Do you have a chronic cough or wheezing, any kind of productive sputum?
No, ma'am.
Good. Do you ever cough up blood?
No, ma'am.
You know. What about night sweats?
No, ma'am.
Do you have any kind of regular exposure to radiation? Not at your job?
No, ma'am.
Good. Let's see. Do you have trouble breathing, whether you're laying down or sitting up, changing positions?
No, ma'am.
At night, you don't have any trouble breathing when you're flat in bed for a while?
No, ma'am.
Good. And you told me that you don't have any other health conditions such as hypertension, never had a heart attack. Is that right?
Right.
Okay. Do you normally feel like you can, when you're out with the family and you're going to the park, that you can exercise pretty well? Do you feel like you have stamina to keep up with it, or do you get winded or chest pain?
Well, pretty well just go till you get winded. But but no, I don't. I don't have any issue with it.
Okay. And what about the vasculature of your legs? Do you feel like your blood vessels, pretty much your whole, what do I want to say, your circulatory system, do you feel like it's adequate, or do you ever get pain in your legs when you're walking so long?
No,
No?
I think it's fine.
Okay. Have you ever had any blood clots in your legs or in your lungs anywhere that I should be aware of?
Not that I'm aware of.
Okay. Have you ever had anemia or bruising? Do you have any kind of abnormal blood cells that you know about?
No.
Good. Have you ever had, I'd like to now discuss your kind of your gastrointestinal tract. Have you ever had any trouble with appetite, weight loss, or weight gain that was unintentional?
No, ma'am. Just Oreos.
Do you feel like you have trouble digesting any certain kinds of foods?
No, ma'am.
Do you ever get heartburn?
No, ma'am.
No? Okay. What about, do you have trouble swallowing at any time?
No.
Do you ever feel like you suffer from nausea or vomiting?
No, ma'am.
And you don't ever have like where you're throwing up blood or throwing up anything?
No, ma'am.
Okay, good. Do you feel like your bowels are pretty regular?
Yes, ma'am.
About how often do they move?
2 or 3 times a day.
Okay.
Almost with every meal.
Okay. What about, do you ever have complaints of constipation or diarrhea?
We eat a lot of roughage.
Okay, good.
A lot of fiber.
That's good to hear. How would you describe the consistency of your stool? Do you have any concerns?
Well, it's not hard. It's like a semi-solid sort.
Okay. What about, do you feel like you have any complications with flatulence, excessive, or, like a very abnormal amount?
No, ma'am.
Good. Have you ever had peptic ulcers or ulcers of the stomach?
No.
Okay. And any kind of bleeding in the past, whether vomiting blood or out through your stool?
No, ma'am.
Good. Do you feel like you have any concerns with your diet? I know we kind of already discussed what you normally eat, and you just told me you eat lots of roughage. Do you have any concerns or questions about your diet?
No, ma'am.
That's a lot of no ma'ams. Moving on to your endocrine system, I would like to ask you if you have had any thyroid enlargement. I know you said that you have hypothyroidism, but have you noticed anything physically different with your thyroid?
Well, no, I haven't. But whenever they diagnosed me, they did that Dilly Bopper where they look with the sound.
Oh, the ultrasound?
Yes, ma'am. Mm-hmm. And they said that it was my thyroid gland was enlarged, but they said it wasn't like cancer or anything. It was just big.
Okay, that sounds like your thyroid might have been growing larger to accommodate the low thyroid level that you have. So
okay.
That kind of goes along with the diagnosis. All right, let's see. Moving on, I would like to go lower in your review of systems. Would you tell me if you've ever had any trouble urinating or had any kind of dark or very concentrated urine where it burns to urinate?
No, only on a hot day when you don't really get to drink a whole lot on location, but nothing in the way of like an infection.
Do you feel like you normally stay pretty hydrated?
Try to.
About how much water do you drink a day?
It depends on the day.
Mm-hmm.
Depends on how hot it is outside.
Okay.
But that's pretty much all I drink. I mean, I couldn't quantify it. It's several bottles at least.
All right, good. And have you ever noticed anything abnormal with the urine or difficulty urinating?
Oh, no, ma'am.
Okay. Have you ever had any problems with your prostate?
Not sure I know what that is, but I guess not.
Okay. We'll do some education on that. Moving on to your musculoskeletal system, do you have any joint pains, any muscle pains? Do you regularly get muscle cramps?
No, ma'am.
Have you noticed any swelling, redness, or any problems with the muscles?
Hmm.
Okay. And you've never had any kind of muscle injury that you're aware of?
No, ma'am.
Good. Now I have some questions about the neurologic system, and you can let me know if you have any questions or concerns, okay? Have you ever had any kind of fainting spells,
No, ma'am.
dizziness?
No, ma'am.
Okay. What about weakness or even a temporary paralysis?
No, ma'am.
All right. Do you feel like you can sense all of your digits, all of your extremities? You have good feeling and you don't have any irregular pains?
No, ma'am.
Good. And moving on, I would like to look at your mental faculties and see if you have any kind of depression, mood disorders. Do you have any trouble concentrating or regular anxiety?
No to all the above.
Okay. Do you ever feel like you get an abnormal amount of tension?
No.
Okay. Do you ever have suicidal thoughts where you want to hurt yourself or hurt someone else?
No, ma'am.
Do you feel like you sleep pretty well?
Yeah, as long as it's cool.
Okay, so just not whenever it's too hot. All right, and moving on again to your male reproductive system. Do you have any concerns about anything about the male system? No?
Got 6 kids. It seems to work just fine.
Okay. When was, if you had to guess, when was the about your onset of puberty?
Oh, I don't know. I reckon probably around 12.
Okay. And do you ever do any self-testicular exams to just make sure you don't have any lumps or any other abnormalities that could cause concern?
No.
Okay. Do you feel like you have any other questions or anything for me that I could answer that you want me to be aware of?
No, ma'am.
Okay. Well, I think I got a pretty good overview of your health, and I look forward to establishing a primary healthcare provider because we do look forward to getting your hypothyroidism under control and making sure that you're on the appropriate medications. That way you don't have any symptoms related to that, okay?
Thank you.
Okay. Well, it was good to talk to you. Thank you.